Good morning and welcome to the 9:30 call here on June 5th. It's good to see folks. We are excited to have a team to talk about research today. We've had lots of different things this week in the 9:30 call. So I'm going to turn it right over to Erin Bumgarner, who if you could each of you just share a little bit about you, and then we're so excited to hear your presentation.
Perfect. I'm actually going to kick it to Arjun from EEC, who's going to kick us off.
Okay.
Thank you, Amy. Good to see you and good to see everyone. Thank you for being here. I will actually, I'm not the star of today's presentation, so I will do a very short intro and then pass it back to Erin, Michelle, and Jess. But just very quickly, I'm Arjun Shah. I am the Preschool Development Grant Manager at EEC, and it was under the Preschool Development Grant that we conducted the work that Erin is about to talk about today. Just kind of background around this, as part of the Preschool Development Grant, which is a federal grant, we were required to conduct a needs assessment, but that requirement was very broad and open-ended. So EEC said, let's use this as an opportunity to go out and hear from families. Let's lift the voices of families and really use that as an opportunity to better understand the family experience and therefore figure out what EEC can do to better meet and support that family experience and align the work of our agency to that. The team will talk about it a lot today, but we're going out to families. We wanted to learn a few things, really. How do they access care? What were the perceptions on their choices and the quality of care they eventually received? What were their overall preferences and how that match or not match the care that they eventually found? And then finally, how that would differ for different folks in different geographies, different demographics across the state. So I will pass it to our very stellar research team, Erin Bumgarner from MEF Associates and Jess Goldberg and Michelle Thompson from TIER, who will give short intros of themselves, and then we can jump into the research and see results from that work.
Great. Thanks so much.
Thank you.
All right. So hi, everyone. I'm Erin Bumgarner. I'm the project director for the needs assessment. And as Arjun said, this is a collaboration. So I work at MEF Associates, and Jess and Michelle, who will present in a little bit, are coming here from Tufts University. So let me just get us started on the next slide by telling you a little bit about who we heard from as part of the needs assessment. So as you can see here, we conducted a survey and focus groups with caregivers. The survey really allowed us to go broad. So we heard from a lot of different caregivers across the state. There were about 1,500, as you can see on the slide. And we use the focus groups to go deep, so to get more information about people's experiences and journeys through the system. Both activities were done in multiple languages and involved a combination of in-person and virtual data collection activities. And I just want to pause and say a big thank you to everyone who helped make this data collection possible. So some of you on the call may have helped us along the way. Thank you. But thank you definitely to the advisory group that included both parents and childcare providers who helped us make decisions along the way. Thank you also to EEC staff who reviewed our materials and connected us to people. And then a huge shout out to CFCEs and folks at community organizations who took our requests and ran with it and really helped us to connect with the families that you serve. We wouldn't have heard from so many parents and caregivers if it hadn't been for your support. So this slide just shows you a little bit about kind of where we heard from folks. So you can see we had a nice geographic spread from the survey and focus groups. And we were particularly excited to have representation from caregivers in places where we typically are not hearing from caregivers in our research activities. So this includes Western Massachusetts as well as the islands. What you don't see here is some additional analyses that we did to compare our sample to the state population, to other data sets like the census. And what we found was that our samples were actually pretty comparable to the overall population in some exciting ways. There were a few small differences that I will just mention. One is that our sample was actually more racially diverse than the state population. So we heard from a higher percentage of Hispanic and Black caregivers. And then we also had a slightly higher representation from places like Western Mass and slightly underrepresented in the Northeast, but otherwise had nice regional distribution in our data.
We have a 413 appreciation already in the chat.
Yeah, yay. That makes me happy. That was a big goal of ours, to hear from folks we don't typically hear from in the research. So we're here today to give you a very brief snapshot. I'll tell you at the end of the presentation how to get more information, but we just released a 5-part brief series, which you can see on this slide. There's an introductory brief that gives you the very big picture, as well as technical appendices with all of the details from the survey that we did. But today we're going to focus on the 3 middle bubbles, which are the 3 briefs that contain most of the findings. So like Arjun was saying before, these cover things like how and why caregivers search for childcare, how they make decisions, and then ultimately where they end up, including how satisfied they are with those care arrangements and how they navigated through the system. So I'm going to talk briefly about the first brief, and then I'll hand it over to folks at Tufts to talk about the other ones. So the first brief focuses on caregivers' experiences with their childcare search, and it draws attention to a variety of challenges that they had in the search process. So you can find information in this brief about why families search for care, how they search for care, and ultimately where, the outcomes of their childcare search. And one of the key takeaways from this brief is that caregivers were pretty frustrated by the difficult search process and expressed a need for up-to-date consolidated search options and resources. And you can see in the pie chart on the right-hand side that about half of the caregivers we talked to, so 42%, couldn't find childcare that met their needs. And so this included folks who either gave up searching, stayed with an existing provider, or said they were continuing to search. Something you don't see on the slide here, but that I want to mention, is that we saw that families who are financially secure had more success in their searches. That's not necessarily surprising to us, but obviously is concerning. I want to draw attention to that. And then I'll just briefly say these trends were consistent with what we heard in the focus group. So there's more information in this brief about how caregivers describe the search process to be time consuming. They experienced long wait lists, and if they were lucky enough to find childcare, sometimes ran up against additional challenges like finding out that it was only half day. And we have a lot of really good quotes in the brief if you want to go there to see them. But one that I particularly appreciated is in this blue box here, which says, one caregiver told us, "There's no hand-holding, and I'm not asking for hand-holding, but there was no website that worked for me. I'm typing in things like childcare, Cambridge, and then you'll get a website, care.com, consider an au pair." So yeah, you can go to the brief one to find out more about caregiver experiences with the search process. And I'm going to hand it to Michelle to talk about the second brief about how caregivers make decisions in this journey.
Thanks, Erin. So brief 2, like Erin just said, focuses on how caregivers made decisions about childcare for their families and begins by exploring caregivers' priorities and how they weighed priorities when selecting a childcare arrangement, and then describes the types of childcare that caregivers preferred to use. So here in brief 2, the key takeaway was that caregivers felt like they had to take what they could get as long as it was available, safe, and semi-affordable, which is not to say that they didn't have strong feelings about other characteristics for their preferred childcare. But as we'll show in the flowchart, most families just didn't have the opportunity to select a childcare based on all of their preferences. So starting with the top pink box next to the star, findings from the focus groups showed that caregivers typically considered their basic needs first, such as affordability and safety. Then moving to the middle pink box, the flowchart shows that if caregivers did find an arrangement that met their basic needs, they would then consider convenience factors, which included things like location of the arrangement. Finally, while in reality, few families ever got to this point in this lower pink box, those who did have multiple options that met their standards for basic needs and convenience could consider what we called values-based factors, including things like communication with the provider and the teacher's level of experience. So to summarize, most families had to make compromises, and although caregivers consistently expressed a desire for safe, high quality, convenient care, very few families got to choose a childcare arrangement based on all of those criteria, given limited availability and unaffordability of options. And I'll pass it over to Jess to talk about brief 3.
Thanks, Michelle. So in brief 3, we describe the types of childcare arrangements that Massachusetts caregivers are using. First, a broad snapshot that's based on the survey findings, and then a kind of a deeper dive into caregivers' experiences based on focus group findings. It also summarizes caregiver satisfaction. And the key takeaway in this brief, in keeping with what we've been hearing, is that while some people are able to navigate their childcare journeys with relative ease, the typical journey is a bit more tortuous, like characterized by a lack of access to affordable options, piecing together multiple arrangements. We'll talk a little bit about that next, and sometimes even having to make career sacrifices. So during the focus groups, we asked each caregiver to complete a journey map activity to describe their experiences with their early childhood programs and services from their child's birth to the current age, typically, which was around preschool or kindergarten by that point. And while each caregiver situation and childcare pathway was unique, our team was able to identify 5 patterns or journey types, you see them there on the right side of the screen, that reflect most participants' stories. I'll talk through each one of them. So the first, the mostly seamless formal childcare, describes caregivers who were generally able to find formal care that aligned with their schedules and their needs. These families tended to be either sort of high income or low enough income that they qualified for childcare financial assistance or a voucher. The second group, the cobbled together care, describes caregivers who couldn't find or couldn't access the childcare they wanted, and so they had to kind of piece together multiple arrangements, usually both formal and informal. These families tended to hover just above the eligibility cutoff for a voucher. Parent care, not by choice, notice the frowny face, is similar to the cobbled together group in that they could not find childcare that worked for them. But unlike the cobbling group, who are sort of blending formal and informal, these parents were ultimately just sort of opting to stay home until their child could get into public preschool or kindergarten. And again, these families hovered kind of right above the eligibility cutoff for a voucher. Parent care by choice, notice the smiley face, refers to caregivers who had actually opted to leave their careers for now, tended to be a little bit more satisfied with their situation, so they're staying home with their babies. These families were typically middle and higher income. And then finally, we have the friends, family, and neighbor care group who forewent the formal system entirely in favor of informal care arrangements with people they had personal relationships with. And these families, at least in our sample, tended to be on the lower income side. Next slide, please.
And just as you're talking, the chat is populating with questions, so hopefully the team can read as you are sharing.
Okay, sounds good. So for each of these journey types, we created a graphic like this that helps to kind of illustrate the journey. So this is one person's story. I'm not going to have time to walk through the graphics in detail today, but I encourage you to go to the brief and read more. We've got one for each journey type. So what you see here is an example of that second type, the cobbled together journey type. This is a family that lives in a rural part of the state and is just over that threshold for childcare financial assistance or voucher. Throughout their childcare journey, both parents had to work full time to get by. And the map Callie, not her real name, but we're calling it Callie, covered that period from the child's birth through when he entered school. So just to orient you to the image, the red boxes at the bottom show the actual arrangements they had at each point in the timeline, with the stacking showing simultaneous multiple arrangements. And Callie's journey took her through a bunch of wait lists, as you can see in the little gray boxes above, kind of narrates the journey. Childcare arrangements that were only part-time because that's all they could get or all they could afford, and the kind of constant juggle of piecemeal care arrangements to cover her and her husband's work schedules. This also gives you a picture of how many transitions their child had to face in any given day, week, and year. And then we have some quotes at the bottom. So next slide, please. So here's a couple more highlights from the findings in brief 3. Again, there's lots of stuff in there. You should definitely go read it. In general, caregivers described a kind of fragile balance between their childcare arrangement and their ability to work, with more than a third reporting that they had missed work due to childcare challenges, and more than a fifth saying their career had been interrupted by childcare challenges. When asked what childcare characteristics would best allow them to work, caregivers were looking for extended hours. This was especially true, actually, for those who were less financially secure, and more flexibility. When asked what they would want if cost wasn't an issue, most caregivers indicated a preference for center-based care. But what's not seen on the slide is that there's some nuance there, because families who were currently enrolled in a family childcare were actually more likely to prefer a family childcare than a center. So this suggests that even though overwhelmingly people preferred center, there was also alignment between caregivers' preferred and actual care arrangements when they took the survey. And then finally, caregivers were generally satisfied with the care that they ended up using, with the majority saying it was as good as they could have hoped for or better. Satisfaction was higher for some characteristics than others. Again, not seen on the slide, but here's a little nugget. For instance, of the folks who indicated safety and cleanliness was one of the factors that mattered most to them, 98% were satisfied. And on the other hand, among those who named cost as mattering most to them, only around 2/3 were satisfied. And now I'm going to turn it back to Erin.
All right. I think we're answering some of the questions in the chat. I'm not the best multitasker, so.
Well, you're doing a great job putting 9 hours worth of content into 30 minutes. So.
Great. Yeah, hopefully my responses are coherent in the chat. But so some of these questions that you're asking can be answered by going to the briefs themselves, and I just want to tell you how to get to those. But before I do that, I just want to sort of distill this into what we see as sort of the biggest picture takeaway from all of this work, which is that what is really wonderful in terms of what we're hearing from caregivers is that so many of them feel that the childcare settings in our state are safe for their children, and they feel comfortable bringing their children to those settings. And yet what is maybe rising to the top as being most troublesome is the fact that so many parents are having a difficult time actually finding those childcare settings and accessing them, particularly ones that meet their family needs and preferences. So if you're interested to learn more, let's see, I think, Amy, you put the chat that goes to the MEF website. There's also, I'm putting another link in there they're also on the EEC website.
Ashley White added that one already.
Oh, great.
Yep.
Okay, perfect. So you can go there to dive in. And then if we just go to the next slide, I want to briefly mention one other resource that was just posted to the EEC website, which is based on a small evaluation that we did of the ECE staff pilot program. So this is a program that many of you probably know about that provides priority access to childcare financial assistance to income eligible staff in licensed settings. And we learned from speaking, through a survey and interviews with early educators that a lot of them were making changes to their own children's childcare arrangements to make it possible for their children to attend the same programs where they work. We also heard that the pilot allowed them to access care that was previously unaffordable. And there were a variety of perceived impacts that were positive, which you can see on the slide here, in terms of financial stability, recruitment, retention, and other things. So when you go to the EEC website, be on the lookout for this as well. And then I realized earlier I wanted to hand it off, Arjun, for you to say a quick note about kind of how EEC is thinking about the childcare search, and I just plowed through that, so I want to hand it back to you briefly. I think there were some questions in the chat.
No, thank you. It's related to Titus's question in here, which is like, what does this all do for us in EEC? I think one, and I didn't put this in my response to Titus, but just getting this information out there is valuable in that it provides a clarified experience of what the families are experiencing in the state. I think all of us, I'm an expectant father, so all of us sort of know what the childcare search is like right now. But that is built off of anecdote primarily, and I think getting a holistic view and going as deep as this team did is just very valuable to crystallize what is important and what's less important. I think the piece that Erin said to sum up the study is very valuable, that once people are in care, they're relatively satisfied, but finding care, something that's affordable, or even just navigating a difficult search system is very hard right now. So that's a big part of it. But very practically, where this work goes is I think some of the things that are in here we're already directly acting on. We just finished some work with graduate students around our childcare search engine and how it can look and work a lot better to support families in just navigating that. And then there's the longer term view of all of this, which is that there's a lot more to do as a state, and we are in the process of developing a strategic plan, and any good strategic plan, especially in this field, should start with family voice. And so the things that we've heard from families here are really a major input for the work that's going to happen in that space.
Thanks so much. And Michelle, maybe we can stop sharing so we can all see each other again. And there are so many questions, and thank you to the team for answering them in chat. One question kind of coming off the research summit that was held last month. How are you connecting this research with the legislature and other policymakers? I think especially the scholarship one, and maybe you can come back to talk about that. Because we know that the legislature heard about the need for that kind of a prioritization of the early childhood field on the 9:30 call and other places. And I think, so how do you kind of connect back to policymakers? Or how can we help?
Yeah, I think I remember that conversation at the summit and thinking, I think there was a room of people kind of all in consensus that we need to do a better job at doing that. So I think our goal today in coming here is just to get the word out to the folks who are in those spaces. Maybe we can even copy our email addresses and put them in the chat for folks.
That would be great.
We would love to connect with people after this call. If the folks on this call see a connection. I know there were some things in the chat, for example, that we didn't talk about today that I was trying to push people to go look at the briefs because there's so much.
Appendix C, I see, is very full of information. That I think anytime you want to come back, because I think part of that give and take is coming to places like this to share so we can be good ambassadors of information. And then Arjun, it's so helpful to hear like what this means for the state, and appreciate the kind of learning stance. How do we integrate and implement these findings? Love the journey graphic. I think that's really powerful. I think strategies could also blog about these to highlight them. I think any way that we can help connect all the research that you're doing with all the lived experience that people are feeling. Any last words? We have 2 minutes, so I don't know if there are questions. There was Donna talked about the pain point of transportation, like all the pieces in once you're in a program and trying to support children and families.
Yeah, Michelle, I was wondering if you would just want to say a couple words about the flow chart, because I feel like that is where in brief too, I didn't get a lot of this.
Yeah, I think our brevity in the flow chart for the purposes of the slide did leave out a lot of these details, which you'll see in the brief. So things like transportation, things like someone mentioned cultural congruency, all of those things came up. Things about finding an appropriate childcare placement for something that's accessible via transportation, or something that has the right hours based on your work schedule. So all of that did come up, but just in the flow chart itself, we only had room for so many examples. So you'll see all of that in brief too.
For that, Michelle, and just in general, because a lot of this information couldn't even go into the brief. We had so much information, which is why it definitely reach out to us. That this issue of special needs, which a couple of people have mentioned in the chat, came up again and again in the focus groups as sort of one of the stumbling points that they had in finding care that worked for them. So reach out to us. We love to talk about it, and there's such information.
I think also the quality piece, right? And we've been talking about that, more explicitly, I think, since COVID. And we talked about it a lot for many years, but I think in a different way when you think about supply, quality, how do you measure it? How these all things come together? And so, yeah, I think also with the follow-up from the research summit, there's a lot of thinking about how we tie all these worlds closer together, and create this feedback loop because we are so grateful and appreciate the research. We know how hard it is and appreciate qualitative and quantitative research as well. And we know that so many folks on this call are researchers, whether they have the title or not. They are collecting information that is going to be powerful for policy, recommendations and change. So we really appreciate you all coming and kind of sticking to the 30 minutes, which we know is hard. I'm thinking now, like maybe there's a way that we can think about how to bring research more regularly to the peeps doing the work. Well, thank you everyone for joining us today and this week. We'll be back next week. I can't remember who's on the call, but we are booking for July and August. So if you have a topic or a speaker or something you want to talk about, just please let us know and we can get them on the 9:30 call. Thanks so much for joining us and have a great weekend. And we will see you on Monday. Take care.
Thank
And
you.
I'll save the chat and send to the team.
Thank you.